Bye. That's it for that. Let's do DVT-PE. Told you that was quick and dirty. Now, look at the picture. Shall we look at the picture? Let's look at the picture. Where is the clot on this patient? Maybe even a leg. Because what they do, they cut the rest of it to show you where it's going. So that might have just been, I don't know. But it's bottom extremity. Is that safe to say? Now, let's follow it together. Where did it go up? What is the structure right here? Write it down. It's the inferior vena cava. Write it down. You gotta know our body parts. We just did this with a fat embolism. You should not be confused. Okay, now, so let's follow the clot, everybody. Here we go. We're going up the inferior vena cava. We make that turn into what part of the heart? Highlight it. Right atrium, highlighted. The words are there. Let's highlight the words. Now we're going down. Look at that little thing. What is that flippy floppy thing? Tricuspid valve. And we're going to keep on going. Where are we going now, y'all? Right ventricle. Do you see how it's talking about venous return? Right ventricle? Okay, good. Now we're going up. Uh-oh, it say something. It say what? To lungs. So what is that little flippy floppy? It's a what? Pulmonary artery. Now this is where things get confusing. Watch this. If I take my fingers and keep on going out in opposite direction, right lung. On this side is my left lung. Do we agree? Look at the left lung. The clot went through the pulmonary artery, ended up in the left lung. You can't go but so far because the left lung's branches get smaller and smaller. The clot is too big to travel all the way down to the alveoli. Do we agree? So it's pretty much still stuck in the pulmonary artery. This is where your patient goes, I can't catch my breath. Now, I don't know if you remember, but a few weeks ago, I read you a story from a nurse who took this class that remembers my demonstration that I just gave you. And that's what she had at her job. And it kicked in. Shelly did that in class. This is a pulmonary embolism. And she saved that patient's life. What did she do? She questioned the order, the discharge order. Who questioned the order Saturday? Gina. What was wrong with her patient? Sickle cell. What did that patient have? Shortness of breath that was unresolved no matter what you did. She saved the patient's life. She told you Saturday what she did. Your patient is not dramatic like this. I can't catch my breath. And remember, the drama is related to the size of the clot. So when they do it like I just did it, that clot is big as hell. When they do it like this, can you sit me up? I'm just having a hard time breathing. You want some O2? Yeah, maybe that'll help. Smaller clot. Everybody don't get it. Everybody don't notice. Everybody don't pay attention. But when she got oxygen, it didn't get better. And she's coughing. Then she's going to come. Chest pain, coughing, shortness of breath. Oh, we're dangerously close to the PE. What will seal the deal that I hope you never see, but it did seal the deal, is hemoptysis. What the hell is hemoptysis? What the hell is this? Coughing blood. That's coughing up blood. Remember? Coughing up blood. Now don't worry, Jerry curl. It's on the next page. Turn to the guy. Let's look at the brother. People out. Says pulmonary embolism, right? Okay, let's have a little fun, shall we? If if you consider that every single respiratory emergency has a respiratory song attached to it, and this is a respiratory emergency, let's find the song. Do you see where it talks about hypoxia? On the right-hand side at the top, help your cousin. Uptake. Some of them ain't even on the right page, bless them. Shit. Y'all see it? Okay, say hypoxia. Pulse ox less than 90, right? Okay. There's some tachypnea. Do you see the dyspnea? That's part of the song. There's some tachycardia. That's part of the song. This is kind of cool. Okay, now, you got a lot of the song. You only needed one of them, right? You only needed pulse ox less than 90. That's enough to convince you right there. But you do have the song, is what I'm saying. Now, go over to the left and highlight something that is very important. It says sudden. Remember what I taught you? Shit that happens all of a sudden is crazy. This is sudden, sharp chest pain. Go on the right side of the page. He's holding a nasty ass Kleenex. What's on it? Blood. There go your hemoptysis. Now you got to be careful. This is where you go wrong, nurses. Be careful. Look at the ABGs on the bottom of the floor. That's an ABG, ain't it? Oh, okay. So guess what? The pH and the PCO2 always go together, don't they? Okay, so here's the deal. If I'm doing this, what am I doing? Hyperventilating. If I'm hyperventilating, I'm blowing off what? CO2. If I'm getting rid of CO2, then I am in alkalosis. Look at the pH. Alkalosis. Here's why you're going to be confused. Because if you get to thinking, oh, this is respiratory distress, he's going to go into respiratory acidosis. You're right, but he's not going to do it right away. It's going to take time. Initially, he's panicking because it happened all of a sudden. What you need to know about alkalosis, it happens all of a sudden. You're panicked. You're anxious. You're restless. You're breathing fast. That's what's happening initially. Be careful with this on your test. It is not respiratory acidosis, which is true for 99% of all respiratory failure. We didn't fail yet, we just got it. We're panicking. We're hyperventilating. We're coughing. All of that means blowing off CO2. Be careful, because you know who else did that to you, and you're going to get it wrong if you're not careful? Early asthma attack. Early asthma attack, pulmonary embolism, happens all of a sudden. Alkalosis. Respiratory alkalosis. Okay, now look at this man here. Look what we're doing with him. We have hung an anticoagulant, in this case it's heparin, but I could have chosen to use a thrombolytic. It depends on the hours. How many hours do I have to hang a thrombolytic? 6 hours. So look at this. Watch this. You got to know your meds. Thrombolytic. Look at the word. What does lytic mean? What is thrombo? Destroy the clot. What is it called on the street? A clot buster. What's it called in my hospital? Pitiful. TPA. I heard you, baby. Somebody back here got some brain cell activity with a synapse. TPA. Streptokinase. Right? You could say that one. You could say alteplase. You could say tissue plasminogen activase. Whatever. It's in your pink packets. This is TPA. It's a clot buster. I could use that if I was in the first 6 hours of this embolism. If I'm not, guess what I gotta do? Heparin. What do I check heparin? If I'm doing a PE and I hung heparin, I cannot turn the heparin off until I hang the until I get and the Coumadin is therapeutic, then I can shut the heparin off. I might want to say again, if my physician buster, but instead chooses to order an anticoagulant like heparin, I am going to hang the heparin and we're going to get a therapeutic PTT. We're going to add Coumadin so we can facilitate this patient going home, but Coumadin does not become therapeutic for 3 to 5 days or more. So I have to keep my heparin on until my PT and INR are therapeutic, and then I can shut the heparin off. Heparin and Coumadin may be on at the same time until your Coumadin is therapeutic. If you look at his risk factors, we just did this the other day. Let's make sure we put some in order at the bottom of the page, and then we're going to see how they measure up to the list they gave you. I gave them to you in order. What were the risk factors? Number 1 risk factor for DVT. Nope. Surgery. You're going to mess that up. Surgery is the number 1 risk factor. So that includes trauma. In other words, you fractured your hip. You got a knee replacement. You had a C-section. 30% of women, that's some bullshit right there. But that's what we're dealing with right now. Maternity patients always do this shit. So surgery is number 1. What was number 2? Immobility. What was number 3? Obesity. What was number 4? Estrogen. What was number 5? Smoking. Better know them. Now let's see what they got on their little list. They got immobility, they got the obesity, they got history of a previous DVT. That's kind of important, ain't it, y'all? Because that's what Serena, the tennis player, figured out. I don't know if you follow her like I do, but Sister Girl had a clot a long time ago. She had a PE about 5, maybe 6 years ago. Then when she had the baby, she did it again. If I'm her OB, she got heparin or Lovenox her whole pregnancy. She didn't, but if I'm her OB, that's how I roll. So if you've had a PE before, you damn sure need heparin or Lovenox when you get pregnant. Because what do we say about pregnancy? Hypercoagulable state, estrogen. Any of you in this room that actually had PE or DVT before, if and when you get pregnant, you better make sure they put you on Lovenox or heparin, because that's what you need. You in a hypercoagulable state. You're at high risk for a clot. Okay? So if you keep on looking, it says oral contraceptives. Oh, that would be estrogen. It says postpartum. Ooh, that would be estrogen. It says post-op. That would be surgery. They got the same thing we did, but they forgot one. What did they forget? Smoking, so added. How the hell is smoking a clot, y'all? And don't be telling me about vasoconstriction, because that's true, but I don't want to hear that. I want to hear something different. Smoking activates platelets. Yes, it causes vasoconstriction, so blood does not flow through very quickly. It just slows it down. Slow blood clots. But it also activates platelets. Okay, y'all sound like y'all jamming on this. Now, so just put at the top of your page, 100% of PEs started with a DVT. First nursing action when a DVT is suspected is bed rest. They will need what to diagnose the DVT? What? Ultrasound. A Doppler venous ultrasound. Watch this, y'all. D equals Doppler D, and D dimer. But this is diagnostic, this is just helpful. D's. Of DVT is D for Doppler and D for D dimer. All these, keep them together. I wish I could say diagnosis of a PE was easy. It's not. It's a CAT scan or a VQ scan. We talk about the VQ scan in procedures. Now, let me just say one thing, because I promise you, you know that page I told you was the most important in the packet? It's a patient education, so it's so easy to read it. I don't have to read it to you, I just did it. But I love it because it explains everything. It tells you how an anticoagulant does not break up a clot. It prevents more clots and prevents the current clot from getting bigger. It tells you that. But then also, I want to say one thing, because y'all be messing this up. I want to remind you of what is currently happening with Coumadin. What is your dietary teaching? Should they avoid salads? Yes? No. No. That's old, outdated bullshit. Here's what they need to do. Don't be telling them to decrease their intake of green leafies. Outdated bullshit. Don't tell them to minimize their intake of salad. They can, long as they do it every day for years. What I tell you is, whatever you eat every single day in terms of green leafies, that's what you better eat every single day. If you and you wouldn't have it on a silver platter, then don't start no green leafies now. But if you eat them every day, then you better eat them every day. Your INR and PT will catch up. It'll figure you out. It'll be your value that makes sense. You gotta know that. Stop leafies, all bullshit. 10 years ago bullshit. Oh, rule is keep it consistent every single day. Okay? That's it. These things down here are in your packet, so you read about them. There's no need to waste your time. And so